Welcome to Med Insight. In this video, I will guide you step by step on how to interpret your full blood count result. So by the end, you'll be able to confidently interpret this result yourself. Let's go. A complete blood count is a fundamental blood test used in medical diagnostics to assess a patient's overall health and detect various conditions. The major components of the full blood count are red blood cells, white blood cells, and platelets. In this video, we will focus on the red blood cells. Red blood cells are essential for oxygen transport throughout the body. In a complete blood count, red blood cells are not only counted, but also analyzed for their characteristics, including size, shape, and hemoglobin content. The red blood cell differential includes the following parameters. The first on the list is RBC, that is, red blood cell count. It is the total number of red blood cells in a given volume of blood. A high RBC count may indicate conditions such as polycythemia vera, dehydration, heart and lung diseases, kidney tumors, amongst others. A low RBC is associated with blood loss, nutritional deficiencies such as iron, vitamin B12 and folate, certain medications, alcohol abuse, chronic diseases, some tumors, genetic diseases, bone marrow disorders, amongst others. The next on the list is HGB or HB, that is hemoglobin. It is a protein in the red blood cell that carries oxygen from the lungs to the tissues. High hemoglobin can occur due to dehydration, high altitude, lung or heart diseases. Low hemoglobin indicates anemia from blood loss, poor nutrition, certain medications, bone marrow diseases, chronic diseases such as kidney diseases, amongst others. Here are some symptoms of anemia: fatigue, difficulty breathing, palpitations, headache, lightheadedness, tinnitus, anorexia, amongst others. You may pick up signs like pallor, tachycardia, and murmurs. When diagnosing a patient with anemia, we tend to look at the mean corpuscular volume, or MCV, to know the specific type of anemia. Let's briefly talk about MCV. Mean corpuscular volume, or MCV, is the average size of red blood cells. Here is the clinical significance of MCV in diagnosing anemia. In anemia, low MCV, that is microcytic anemia, suggests thalassemia, anemia of chronic disease, iron deficiency, lead poisoning, or sideroblastic anemia. Nomocytic anemia suggests acute blood loss, anemia of chronic disease, bone marrow failure, hypothyroidism, hemolysis, pregnancy, or chronic kidney disease. High MCV in anemia, that is macrocytic anemia, indicates vitamin B12 or folate deficiency, alcohol abuse or liver disease, reticulocytosis, cytotoxic agents like hydroxycarbamide, myelodysplastic syndromes, bone marrow infiltrations, antifolate medications like phenytoin, hypothyroidism, and hemolysis. The next on the list is HCT, that is hematocrit. It is the percentage of blood volume occupied by red blood cells. High HCT suggests dehydration, polycythemia, lung or heart diseases. Low hematocrit may be due to anemia from certain medications, from nutrition, bone marrow diseases, bleeding, or chronic diseases. Next on the list is mean corpuscular volume, which we've talked about already. Mean corpuscular hemoglobin, that is MCH. It is the average amount of hemoglobin per red blood cell. High MCH is common in macrocytic anemias, whilst low MCH is common in microcytic anemias. The next on the list is MCHC, that is mean corpuscular hemoglobin concentration. It is the average concentration of hemoglobin in red blood cells. High MCHC is seen in spherocytosis, liver diseases, autoimmune disorders, dehydration, amongst others. On the other hand, low MCHC suggests iron deficiency anemia, chronic diseases, lead poisoning, amongst others. RDW, that is red cell distribution width. It is the measure of variation in red blood cell sizes. High RDW is found in conditions like iron deficiency anemia, vitamin B12 deficiency, chronic diseases, or recent blood loss. High RDW with low MCV point to iron deficiency anemia, while high RDW and high MCV point to vitamin B12 deficiency. Normal RDW and high MCV point to alcohol, liver diseases, or bone marrow problems. Low RDW, generally not clinically significant, but can be seen in certain chronic conditions when paired with low MCV. Kindly share your thoughts in the comment section on the possible causes of the anemia shown in the CBC results. The red blood cell differential in complete blood count provides essential information about a patient's hematological health. Abnormalities in red blood cell indices can indicate all various diseases we talked about. By interpreting these values in combination with other clinical findings, healthcare providers can diagnose and monitor various conditions effectively. Thank you.
Don't forget to subscribe, follow, share, and like our platforms.